Hi again. This video is going to emphasize the cerebral vasculature, namely the Circle of Willis. So we're going to start here on the image on the left. And at this point, there are two different ways to get into this region. The first is via the vertebral artery, which is a branch of the subclavian. And remember that the vertebral artery travels through the transverse foramina of the cervical vertebrae. Those transverse foramina are the hallmarks, structural hallmarks of those spinal level vertebrae. And the two vertebral arteries will course into the inner skull and will anastomose. Imagine you're a drop of blood. You could have chosen either route. Will anastomose here with the basilar artery. The basilar artery is the posterior or inferior, depending on how you look at it, part of the Circle of Willis, and it will contribute blood to the circle from this angle. The other way to get in here is through the internal carotid artery, and you might remember there are no branches of the internal carotid artery as we go into the neck, but once the internal carotid artery traverses through its carotid canal, it gives off lots of branches. One of which is the ophthalmic, one of which is the central artery of the retina, the middle cerebral artery, which is located here, is given off by the internal carotid artery. So the circle starts with the internal carotid artery. It includes the MCA. Now this is drawn in such a way that it looks like the MCA is branching off the ICA, but sometimes that branch is super close, and so it's not easily distinguishable. Nevertheless, let's blow this up even more. Nevertheless, from the MCA, the anterior cerebral artery branches off, and also the posterior communicating artery will branch off. So here is labels for that: anterior cerebral artery and the posterior communicating artery. So there's an anterior communicating artery that joins the two ACAs. So ACA, posterior communicating, or PCOA, and then this is the ACOA. The other side is symmetrical to this, and we have an anastomosis between the PCOA and the basilar, which is the posterior cerebral artery. So if we can draw in the rest of the circle, I'll just draw in dotted lines. There we go. Okay, the other vessels that are related to the Circle of Willis include the superior cerebellar, which comes off here at the top of the pons. So superior cerebellar artery. And then the ICA, the so-called ICA and PICA. So here is the anterior inferior cerebellar artery, and then off of the vertebrals is the posterior inferior cerebellar artery, the ICA and the PICA. They're just fun to say. So that concludes the Circle of Willis. How are we going to drain back? Well, these vessels, after they've supplied the brainstem, will drain through cerebral veins, which eventually make their way into the dural venous sinuses. So here are the dural venous sinuses, and you might recall that essentially, here's the cavernous sinus. It will drain eventually via the petrosals, the inferior petrosal in this case, into the transverse on either side, into the confluence, which is located here. The confluence drains the transverse sinus, the superior sagittal sinus, and the straight sinus. And these veins will eventually make their way towards the internal jugular vein. So actually, I drew the vessel, the blood flowing this way. I guess it could go that way, but ultimately the blood is actually going to go this way. So blood would drain down here into the jugular foramen, blood draining this way or this way into the confluence, which drains into the transverse sinus and into the jugular foramen. There we go. And then you've got similar venous drainage from the orbit and from the superior petrosal sinuses. Ultimately, everything's got to get back into the jugular foramen. You can see that from the side here. Here's the confluence. It's actually more of a triangle. Blood will drain from the superior sagittals this way. It will drain into the transverse sinuses and back into the internal jugular vein. Here from the straight sinus. There we go. Please, again, note the location of the cavernous sinus. It is right in the middle of all this mess. It is, it can drain the orbit, and it can also drain into the dural venous sinuses, or sometimes the orbit can drain into the pterygoid plexus, which is located here. Again, this pterygoid plexus can drain eventually also into the internal jugular vein. Okay, I think that's it for the cerebral vasculature. All right, take care.